This recording is over Chapter 52, Assessment of the Gastrointestinal System. This recording is going to be pretty brief. Most of this information is review for you. So a lot of the beginning of the chapter is A&P review of the GI system. That's something I want you to read the chapter in its entirety, refresh that A&P content that you may be a little bit rusty on. Pay attention to any of the boxes while you're reading, those important yellow boxes, or the box about age-related changes of the GI tract. In terms of assessment, of course, read over that section of the textbook also, and then as we go forward with the GI chapters, we'll talk about assessments of each disorder in detail in regards to each disorder that we're going to be covering. In terms of laboratory values, so in your textbook you have a large box full of important GI lab values that you may see. There's certain ones that you're going to need to know the actual numeric value for. Obviously, calcium and potassium, you should already know those. Albumin is one you need to know. The normal value is 3.5 to 5. A decreased value indicates possible hepatic disease, hepatic being liver, or malnutrition. ALT and AST you need to know. If you've had pharm, you should already know these. Normal ALT is 4 to 36. Normal AST is 0 to 35. And we're watching if those numbers elevate, that would indicate there's something wrong with the liver. Also, serum amylase and serum lipase values you need to know. Amylase normal 30 to 220. Lipase normal 0 to 160. Those labs give us information about the pancreas. If they're elevated, we're worried about pancreatitis. Also, cholesterol, normal is less than 200, and as we talk more later on in a different lecture, you'll have more specifics about the normal ranges for HDL and LDL. But for right now, from that lab chart, those are the values that I want you to know, the numeric values for the numbers, and memorize those numbers. We'll talk about the other labs that are listed there as we go forward in lectures. But I just pointed out the ones again that you need to know the numbers for. In terms of assessments, so EGDs, colonoscopies, all that good stuff, we will, again, when we get into detail of these disorders and the types of diagnostic assessments they're using, the first time we talk about EGD in a lecture, we'll come back and make sure that we go over exactly what it is and what you're going to be watching for in your patient.